Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. This one comes in from Reddit, and it's a good one. And the question goes, general question about Mohs surgery and excisions. I'm curious if it's common not to prescribe pain meds for surgery involving removal of skin cancer. I've had 3 removals, 1 Mohs and 2 basal cell, and was told you don't need pain meds before I even asked. The basal cell was quite large and left a 5-inch scar on my back. I used a ton of over-the-counter meds, which felt like it might be dangerous. I'm not sure if this is common or if I need to seek out another doc. Well, that's a good question. And I'm just gonna go over a little background for folks who might not be familiar with what Mohs surgery is, and I'll dive into your question. So Mohs surgery is a surgical technique that's used to treat skin cancers, particularly basal cell carcinomas and squamous cell carcinomas on anatomic sites that you need to spare as much tissue as possible. So for instance, skin cancers of the face, you have to be very careful about how much normal skin you remove because you want to optimize the functional and cosmetic outcome of the face, post-surgery. Sometimes it sounds like you had Mohs surgery on your back. Sometimes more invasive forms of basal cell carcinoma or squamous cell carcinoma, can use the Mohs surgery technique where they basically remove the smallest amount of tissue possible to ensure a clear margin without removing unnecessary amounts of normal tissue. And again, this is done to optimize the functional outcome and cosmetic outcome of the surgical area. And it also allows you to be sure that surgical margins are clear at the time of surgery, because each rim of skin that's removed is examined in real time just to make sure there's no cancer cells that are going to a margin of what was removed. And if there is, you just kind of go back to that one little section that has a positive margin to remove, the smallest amount of tissue possible to optimize functional and cosmetic outcome of the surgery. So that's the background of what Mohs surgery is. It sounds like you're someone who has clearly been around the block, you've had a few skin cancers, and it's a good question. So your surgeon is that's pretty typical, to be honest with you. Even when we do larger surgeries, so remove lipomas and cysts, we typically do not prescribe opiate pain medications, things like Percocet, Vicodin, etc. That being said, I do let my patients know that, if they're in an exorbitant amount of pain or think they need, pain meds beyond what's available over the counter, like, ibuprofen, Tylenol, that sort of stuff, then certainly on a case-to-case basis, we prescribe medications that are more powerful, more powerful narcotic pain medications. But I can tell you, I could probably, name on this hand how many times I've had to do that in the last 15 years. And I think, most Mohs surgeons, like your surgeon, don't typically, prescribe prescription pain medications for Mohs surgery. But if you're someone who is has a dramatic pain response, or, your body better than your surgeon, you can always request this. So, your surgeon might say as part of their spiel before, they perform the surgery, when they're kind of intaking you and preparing you for surgery, that, you typically don't need pain meds. You can say, hey, listen, I had Mohs surgery in the past and I was in a ton of pain. I used over-the-counter pain medications, and I think, I might benefit from some prescription strength pain medications. I'm sure your surgeon could prescribe you, what you need just so you can get through the post-op period as pain-free as possible. So I hope that answers your question. I think, for yourself, you probably don't need to find a new Mohs surgeon if you're happy with the outcome of the surgery, but you can be more vocal with your surgeon. Say, hey, listen, last time I was in a lot of pain. Do you think you can give me something for a few days just so I can get through that period? And I'd be surprised if your surgeon, didn't comply with your request. But, again, every doctor does practice a little bit differently, but it's a conversation that you most certainly should have should you need Mohs surgery down the road. Hope that answers your question. Let's get it.